Yeah, I mean, what I've found over the years is that for any course, but particularly the CBP course, what you're looking for is whether a candidate has the ability to develop the skills in theory, in practice, and in understanding research, and is able to communicate that both orally and in written form in various formats.
Yeah. I mean, yes, you're absolutely right. And in the interview process, application process, we're not looking for people who are finished therapists. We're looking for people who have the motivation, the basic skills and aptitudes, if you like, to become skilled therapists.
Yeah, and I was struck by often people that come through that I've been part of the decision-making process. I've thought, they're really excellent interpersonally and with their role play is really good, but they might be struggling with the theoretical side. But because they've got the strength on the practice side, it means they might have more cognitive space, if you like, to concentrate on really honing the theoretical side, or vice versa.
I mean, in the final analysis, even for qualified therapists, your ideal therapist is a mixture of somebody who has very good interpersonal skills and good technical skills and theoretical knowledge. The balance in each individual is different, and occasionally you will meet people who have almost the perfect balance. For the rest of us, we tend to be slightly overweighted on one side or the other, so slightly better interpersonally and technically, or vice versa. But it's trying to find people who have the ability to develop in all three aspects.
Yeah, so they've got the ingredients, I suppose, that they can kind of shape over the coming 3 years or so. So did you want to move on now to look at the
dreaded KSA?
Yeah.
Yes, let's look at the KSA. It shouldn't be dreaded because it really isn't that difficult. So the KSA is what we said, knowledge, skills and aptitude framework, and what they are is they're demonstrating equivalence to a core professional training. That's what they're for. So in the knowledge category, one has to demonstrate knowledge of life stages and human development, and this is often done by training about child development, about cognitive development, emotional and social development, often across the lifespan. Need to demonstrate knowledge of health and social care approaches, and these are about understanding the sorts of organisations, agencies, policies, procedures and legislation that supports the work of all these agencies. Now, we're not expecting candidates to have detailed knowledge of every statutory body, every legal framework, but it's to demonstrate that you've worked in a setting, really, that you do understand, and that you've got some way of demonstrating that you understand how these work. That, if there is a request for a service to a social care agency, somebody doesn't just go out and deliver it. There's a process to do that, and there's legislation regarding who's eligible for service and who isn't eligible for the service, and to have some understanding about how health and social care frameworks work. I also ask for knowledge of psychopathology, not a word I'm particularly fond of, and diagnostic skills, but this is demonstrating that you have some knowledge of the sorts of problems and definitions that clients approach agencies with, so that you might know something about what constitutes an emotional problem, what constitutes a mental disorder, what constitutes a psychological problem. And equally, we want some sort of demonstration that you have some basic understanding of different sorts of models of therapeutic approaches. So you wouldn't necessarily know all of them, but you might know something about systems work or family therapy, something about humanistic and integrative work, and maybe something about psychodynamic work, or you might know a little bit about CBP, and you might know a little bit about Gestalt. It's just to demonstrate that you have some sort of knowledge of more than one psychotherapeutic approach, because this means that you have some sort of critical stance outside what you're doing. You're not just kind of only steeped in one sort of learning. And then if we move on to the skills framework, the competency in key relationship skills is what you'd expect really, that you've got reasonable interpersonal skills, you can show active listening, you're respectful to clients, you're fairly coherent and genuine, and can build relationships. Maintaining and managing records and reports is exactly what it says it is. So most people who've worked for any sort of agency at all have to manage some sort of records, even if it's only a contact sheet or a telephone record sheet, right up to people who have to write notes from meetings they've had with clients, or reports for other people in the organisation or external to the organisation. And then there's a section on communication within services and with colleagues, and that again is you're demonstrating the ability to work with other professionals, whether they're inside your agency or outside your agency, and that's demonstrated by things like might be letters that you've written or meetings that you've been part of, interagency meetings or care planning meetings, or meetings in the voluntary sector to decide who does what with certain client groups. And then along with this, you definitely need to show that you understand risk and have some worked in some area where you've at some level had to manage risk. It might just be that you've followed the agency's procedures on risks and they've trained you in what to look for. It can be right at the other end that you're responsible for actually doing risk assessments. It could be any of those things, but you have to show some actual skill in this, because this is not a theoretical, I mean it has a theoretical component, but actually it's something that you also learn by experience and following procedures. What people don't do is make out risk assessments in their heads. Well, they better not be doing that, let's say that. You also need to show that you understand some research, but that's just, that you've read things and can analyse and discuss journal articles, research studies, and a commitment to ethical principles. Well, the ethical principles slightly different for BABCP and BABCP. BACP. But again, it's important that this is a demonstration of skill. It's not a theoretical exercise. It needs somebody to actually write a testimonial or a reference saying, we've seen this person working with a client group, and this person does treat clients with respect, or this person is able to maintain appropriate boundaries, or this person keeps confidentiality appropriately. And finally we have the attitudes section, which are what it says really, attitude section, that the person is suitable at a personal level. So the attitudes section of the KSA is usually supported by referees and testimonials, and the candidate writes some sort of mini synopsis biography of their professional life and relevant bits of it. So it says suitable at a personal level. It just means that the person has all the right qualities to be involved in interprofessional and interpersonal relationships with vulnerable clients. So they don't have any criminal convictions, there isn't any sort of history of kind of aggression, they don't have a serious drinking problem. I mean, they're fairly obvious sorts of things. Right, the attitudes part of the framework is usually supported by references and testimonials, and the candidate writes a mini biography related to the things in this section of the grid. Suitable at a personal level is really no more complicated than it sounds. It's suggesting that you need people who you've worked with and to have had some sort of responsibility for your practice, whatever that practice was, to say that you are a suitable person. This involves usually a clean CRB check, that there's no history of the person being aggressive to the client group or being unreliable. They're fairly basic things that you would expect really an employer to be interested in. An inquiry mind means that the applicant recognise that there's always further things to learn, and that they have a kind of critical stance to their own work, so they can look back at their work and say, well, that was okay then, but now I know a lot more, or from experience I've learned this, that and the other, and I've approached my work differently now, or I've recognised there was a particular flaw in it and I don't want to repeat that mistake, so I do it differently. But equally, I've built on certain strengths I have, so I might be much better at listening to people now, or my ability to explain complex things in simple terms has improved. The self-evaluation and reflection we've talked about all the way through this podcast really, which is the ability to reflect on your own values, priorities, how you do things, what you need to do to develop. Receptive to scientist practitioner approach is very much CBP oriented, and it means that you feel, I suppose, comfortable with the idea that the work in CBP is supported by research evidence and empirical knowledge, and that in some ways the actual work you do has that embedded in it. So we might ask a client to test whether their ideas about the world actually are accurate. And a good example of that would be what is generally called in CBT a theory A, theory B position, where the client might believe theory A, that everybody is looking at them in the supermarket and thinking bad thoughts about them, and theory B might be, well, actually nobody is looking at you with any more frequency than they look at anybody else, and one can't possibly know what people are thinking unless they articulate what they're thinking. And we would actually go out, set up a behavioural experiment and test that out. And that's an example of the empirical approach being embedded not only in supporting how effective CB is, but actually being embedded in the detail of clinical CBP with clients. And finally, you're asked to produce this biography, which is only 500 to 700 words, which is of your working life and supports the rest of the grid in a way and the things it's asked for. And effectively there's 3 sorts of evidence that go in the grid, and it tells you which sorts of evidence is acceptable in each section. There's certificated evidence. So for instance, if we go back to the knowledge of human development, if you've done some course at some point where one of the modules had human development as one of the learning outcomes, you could put in a copy of that module learning outcomes or a copy of the certificate for that course, which would count as evidence. Equally, if you had training in working with vulnerable adults or communication skills within an agency, you might put in the certificate from that and some detail of what the training was about if it's not self-evident, to support part of your KSA grid. And finally, really, there's testimonials from professional staff who've worked with you. And the easiest way to construct the particularly attitudes part of it, which is testimonials, is to show the grid to somebody you want to write a testimonial for you. And if they have the capacity, because they've known you across those sessions, to write a little paragraph about each of the sections in the grid, all in one testimonial or reference. Because the way the grid works is you can put the same evidence into more than one place on the grid. So the evidence of a testimonial that says that you're suitable at a personal level, which will be about your personal values and qualities, might also end up in the commitment to ethical principles, because there may be some overlap.
Yeah.
So you can use, say, the same evidence in more than one section of the KSA grid.